You know, March is National Head Injury Awareness Month, and this morning we're joined by Dr. Amanda Dee Richardson to talk about some of the risks associated with concussions, especially when it comes to youth sports. Dr. Richardson, this is such a hot topic among families who have kids playing sports right now.
It is, and when you look at the research out there, it says that there are over 5 million concussions that happen annually, and the largest growth rate is actually between kids of 10 to 14 years old.
Now, we know that a lot of progress has been made.
Yes.
As far as, special helmets, concussion tests that can be done. But when we talk about the numbers and the age of these children, which is so young, what type of long-term problems could we be talking about?
And see, that's just it. We don't know. The first thing is when you get a concussion, that child's likelihood of going into a postgraduate, getting a scholarship, is diminished greatly. In fact, by 20% just by one concussion.
Wow.
And the most common is actually not your high school football. It's actually girls' soccer.
My 7-year-old little girl is playing soccer right now, and I have to tell you that is one of my biggest fears for her.
Yes, and out of the top 10 concussion-laden sports, 6 of the 10 are women.
Wow.
So we actually need to pay attention to both sides of this issue.
Okay, look, before you go, I happen to notice that you have a tomato in your hand.
I do.
What is that all about?
So when we look at concussions, it's very, very simple to use this as an analogy. So a tomato, soft and squishy, yes?
Yes.
Well, so is your brain. And the problem is when the brain gets a bruise, say if I drop this and it starts to bruise the tomato up, you will get a concussion. Even a small minor bump could turn into a major problem.
Yeah.
In fact, one of the easiest ways I demonstrate it is I use my lovely little glass jar here. So we got the brain inside, the skull is more of what the jar would be.
Sure.
So if I get a concussion, do you think that that bruise could affect me long term?
Yeah. Right.
Absolutely.
Yeah. Okay.
So,
well, it's a good analogy, and I know that we're going to be talking about this long term as this month is, heightened awareness. So thank you for coming in. Certainly do appreciate your time.
Yes, and we'll hopefully be able to explain a few ways on how we can help these kids going forward.
Yes, very good. So we'll see you here in just a little bit.
It is 8/19 and March is National Head Injury Awareness Month, and we're joined again by Dr. Amanda Dee Richardson talking about the risks associated with concussions in youth sports. So about half an hour ago, we talked about why children are impacted the most. Now I want to focus on how do people know if they have a concussion? Let's say I'm a football player and I get it from a play. I'm not showing any symptoms, but I may still have a concussion.
Correct. And unfortunately, the testing that's out there right now is very ambiguous, and it's often not even 100% true. In fact, the impact test, which is the standard test, shows a 40% error rate. So the tests are not working. It's putting our kids at a problem, because what we really need to do to help these kids is get a baseline. Figure out where they at before they have a concussion. So we have some FDA technology that we use to take what we call health selfie that says, okay, before you are concussed, you get to compare yourself of where you're at now versus if you have an event, what can you do then?
I asked you this question before we came out, and this is a serious thing now. Is there a sport that a child can play right now without a worry of having a concussion?
And there are, but the problem is there's two different kinds of concussions. There's the impact where, helmet to helmet or head to soccer ball, but there's also a secondary type of concussion called an impulse, which what we'll do is I'm actually offering a couple of different classes that are coming up on what we call concussion roulette, because unfortunately most people think, oh, just take a pill, but there's no true pill that you can take that's going to help a concussion. In fact, that increases the risk of GI bleeds, which slows their progress down. So we're going to have a couple of classes that are coming up. Number one is going to be on March 21st at 6 p.m. and it's going to be held at my office. I'll get you guys the information so that they can register. And then the other one is if a coach or a parent or a group is concerned about something like this, you know what, contact our office. We'd love to go out and actually talk to the parents, talk to the coaches to show them how we can help their athletes.
Real quick, because you talked about the two different types of concussions. We hear a lot about that first type. Do we not hear as much about the second type of concussion?
You don't, and you can see it happening. Like hockey is a very good example where somebody will be going one direction. They didn't get a hit, but all of a sudden their brainstem keeps going forward in their skull and it puts tension on it, so the brain actually hits inside to the skull as a concussion, even though they never actually hit somebody else. So we really got to raise awareness for this. topic.
Dr. D, thank you so much for joining us. A conversation that isn't going away anytime soon.
No.
Thank you so much for joining us.
Yeah.